Hey, good afternoon. This is Roy Wills again with this week's edition of Game Changers. This week I have a special guest, Gary Rothenberg. Let me tell a little bit about Gary, and then we'll get him to introduce himself and talk to us a little bit about Podimetrics, which is the organization he works with. So, Dr. Gary Rothenberg is a board-certified podiatrist, a certified diabetes care and education specialist, also a certified wound specialist who currently holds an associate professor of internal medicine appointment with the Endocrinology division at the University of Michigan School of Medicine. Additionally, Dr. Rothenberg serves as the Director of Medical Affairs for Podimetrics, a mission-driven company committed to preventing avoidable amputations among people living with diabetes. His current role within the industry is aimed at fostering a paradigm shift away from treating complications towards preventing them, particularly those patients populations who are at risk and are likely facing challenges specific to social determinants of health. So without further ado, I'd like to introduce Dr. Gary Rothenberg. And Gary, if you'd tell a little bit about yourself and talk to us a little bit about Podimetrics a little bit more, and that'd be great.
Love to. Thank you so much. It's an honor and a privilege to be with you this afternoon, Roy. Thanks for having me on your podcast. Appreciate that kind introduction. I'm basically a podiatrist. I've been practicing for 25 years now, and I've practiced in private practice. I've worked in the government. I've also now at the University of Michigan, a complete academic program where I do continue to see patients. We also have a fellowship in limb preservation, hopefully teaching this next generation about avoiding complications of people living with diabetes in terms of their foot health. But probably the most important title that I have is dad. And I have a son with type 1 diabetes. And my whole career has been focused on helping people live with diabetes. But my son, who's now 19 and playing D3 football, doing really, really well, he was diagnosed at age 8. So I have learned so much in living with somebody that I love who has diabetes. And diabetes really is a family disease. It affects everybody in the family. So I come at it definitely from a personal vantage, but also from the professional vantage too, which I hope we get to speak about. You mentioned Podimetrics. I am the Director of Medical Affairs for Podimetrics. It is a wonderful platform and opportunity for me to speak with people like you and your listeners. Hopefully, again, as you mentioned, I've been practicing for 25 years. I'm tired of having conversations with my patients about amputations and the unfortunate consequences, especially those that are in a hospital bed, very vulnerable and facing these limb and life-threatening infections. So I've really appreciated my work with Podimetrics, which is a company that, again, as you said, we really want to help people avoid amputations. And the literature, which I know we want to dive into a little bit around what we're doing, but the clear majority of amputations that are performed in the United States are actually preventable. So it's been a wonderful platform to work with the team at Podimetrics on that mission.
Absolutely. Thank you for setting the stage there. So this is very alarming. I mean, a couple of facts, that I dived into here. According to the American Diabetes Association, every 3.5 minutes, a limb is amputated in the United States due to diabetes. Because these alarming statistics are on the rise, I think it's especially important for people with diabetes to know the facts to prevent diabetic amputation. On top of that, it looks like non-traumatic amputations in the United States, 60% of those are performed on people with diabetes. That is insane, Gary.
Yes, I agree. Absolutely. And the real problem, too, is, again, I've been 25 years in practice. I'm still seeing the same level of amputations 25 years later. Everything is progressing, and yet we're still seeing unbelievable communities, underrepresented minority populations. The New York Times and folks are doing exposés. Unfortunately, where I did my residency, San Antonio, Texas, crazy proud of the work and the training that I received there. San Antonio is now deemed the amputation capital of the United States. And obviously, that has to do
Wow.
with the Latino community in that area and the genetics and the genetic
Yeah.
predisposition. And we can't underestimate that role that things are that genetics is playing. But you would think in this age of modern medicine and advances and science, why have we not made a dent in this very significant amputation problem that we have in the United States?
Absolutely. I mean, it is a lot concerning. So let's dive into a little bit about the problems that Podimetrics is solving for this population of complex patients. Let's touch on
Yeah.
that.
Yeah, so I'll set the stage a little bit. The Podimetrics is founded on some very wonderful research and science behind temperature monitoring. And I think your listeners will appreciate anytime we get sick, the usual first sign is a fever, right? You kind of know you're not feeling well. You get an infection, whether it's COVID or the flu or something like that. The number one thing that usually shows up is a fever, and the foot will do the same thing. So years ago, it's been over 50 years, that temperature monitoring and elevation of temperatures in the feet as marked by inflammation. Inflammation is what causes that heat to build up in the foot, which then precedes things like infections and wounds. So in the 1970s, they were doing some great work on that. There was some innovation into the early 2000s by two famed podiatrists, David Armstrong and Larry Lavery. They did 3 randomized clinical trials that showed if you add temperature monitoring at home, you give patients a thermometer, like, that you test your kid in their ear when they might be sick, an infrared thermometer. If you give them that and they check their feet right versus left and compare and look for temperature differential right versus left, that could be a marker of some potential complication that's brewing. That science was
Wow.
really solid. 72% of diabetic foot ulcers can be avoided if, in addition to usual care, which is good shoes, check your feet every day, make sure you're maintaining good foot health in terms of callus care, toenail care, all of that stuff, seeing your podiatrist regularly. If you add temperature monitoring, Doctors Lavery and Armstrong showed we could reduce diabetic foot ulcer recurrence by 72%. The problem
Wow.
was that, and that was great, that was amazing. It's become part of clinical practice guidelines in terms of best practices for people that have demonstrated that they already have a history of foot ulcers. So history will repeat itself. And that's a big important point, that if you have had a diabetic foot ulcer, you are at very high risk to develop another one. But that form that Doctors Lavery and Armstrong utilized was not user friendly because it was very complicated. Many of our patients, I think we'll probably talk about this too, but I always say nobody comes into my clinic with diabetes alone. They all have high blood pressure. They all coronary disease or heart disease. They have mental health issues today. Diabetes is overwhelming. And so the burden of having to do that physical activity, many of them are overweight or obese. They have limited mobility. They can't see or feel the bottom of their feet. So that challenge of home treatment and doing the math to calculate the difference between right versus left, that was too burdensome to these patients who were already overburdened with other health issues and checking their blood sugars and maintaining their appropriate diet. So Podimetrics came around and innovated the idea of how to monitor people at home, in their home, to make it easy. So essentially we have a mat which patients step on. It takes 20 seconds per day. And there's 1,000 temperature sensors in essentially a bath mat. It's the size of a bath mat. And we actually then, the scan is transmitted through cellular-based technology. No one needs Wi-Fi. Nobody needs an app on their phone. You don't need any special connection or hub. The mat connects to the closest cell tower to the patient's home or wherever they are. And then those are monitored through Podimetrics employees. And we use the same algorithm looking for that asymmetry of temperature right versus left. And then the important part is really about the data. But then a Podimetrics nurse, when they see Mr. Wills, your right foot is showing some temperature elevation. What's been going on in your life? We don't lead with, hey, it's lighting up like a Christmas tree, but it's, have you been more active lately?
Right.
Are you breaking in a new pair of shoes? Maybe they didn't, they don't fit properly. So really it's in the engagement and what we do with the data, and then intervene in terms of recommending very low cost interventions, things like staying off of your feet as much as you can, wearing appropriate shoes and inserts, elevating. And maybe it's not the time to do your Christmas shopping in August, but we put you on alert, if you will, to really pay attention to your feet, and then make sure that eventual complication doesn't happen, because we can intervene based on data that we have. So the idea, and kind of a long answer here for you, Roy, but it's really about connecting patients, providers, and data, and utilizing information in advance, so that we can prevent the complications. That's what we're trying to solve for.
Absolutely.
That's the problem.
Makes sense. I mean, what percentage of these cases do you think are really preventable? Is it
Yeah.
10%, 20%? As far
Great
as
question.
actual amputation?
Yeah. There was actually a great article which caught my attention. Is a group out of the Netherlands. They published it. They actually said 75% of diabetic foot ulcers are preventable. And so the
Wow.
literature is actually, yeah. So you shot low at 10%. We know we can probably
Yeah.
prevent 75, 85% of amputations from happening by just intervening soon, and changing the trajectory based on the data that we collect. Yeah.
Got it. That would be a wonderful change that we can bring into the world. Solving some of these things or helping to drive this. This is great. So you kind of gave us an overview of Podimetrics, and including the adverse impact of diabetes and related complications. So let's talk a little bit about what's going on with the ratio as far as people of color, and how many more of those are affected by this, and how many more amputations, and then talk a little bit about the related work that
Yeah.
Podimetrics is leading with the ADA and the
Yeah.
Amputation Prevention Alliance.
Yeah. Appreciate you bringing that up. Unfortunately, there are racial inequities in healthcare today, and diabetes and lower extremity complications are probably one of the prime examples. The literature and the research very recently, in the past few years, is showing that amputations are still occurring in underrepresented minority populations, probably at about 4 times the rate. So for African Americans, it's about 4 times the rate of compared to Caucasian Americans. For the Latino community, it's about 3 times. The Native American population, incredibly affected by diabetes and neuropathy and other complications. And the interesting phenomena that I've witnessed in my career in terms of the Native American population is we're seeing the complications in people living with diabetes in their 20s. I never saw wounds in people in their 20s, 25 years ago. But I have colleagues who practice, in the Southwest, in New Mexico, and their clinics are full of people in their 20s and 30s with wounds and amputations. Whereas traditionally, I'm used to seeing somebody in their 60s or 70s who's lived with diabetes for a long time. So unfortunately, there still is an access issue to healthcare in our country. I think we know that. That's affecting people. And there are biases, and we just have to acknowledge that. The role that social determinants of health are playing. I was very fortunate, again, to train in San Antonio, and my residency director, Larry Harkless, really talked to us about parking at the bedside. And he would say, why is Mrs. Garcia in the hospital now? And you would say, well, she's non-compliant. And he would be really upset and say, how do you know what's going on in that person's life that's really affecting them, the non-clinical things? And I think why I was exposed to that 25 years ago, we didn't call it social determinants of health like we do today. But social determinants of health are affecting outcomes. And if we don't acknowledge that, we're missing a very significant component. So again, at Podimetrics, we're not a care management company, but many of the healthcare organizations that we work with, they have those resources. And when our patients are on the phone and they say, I ran out of my blood pressure medicine, because it's a nurse on the line, we help connect them with the resources for getting their blood pressure medicines again, or if it's transportation issues. Those are very influential in outcomes. And I think it's important to acknowledge that. And we're doing better. We're talking about those issues, but we really do need to understand that the racial inequities in healthcare is just, we need equal access for everybody, and we need a stronger focus on prevention, for sure.
Absolutely. It definitely sounds that way. I mean, what's your recommendation as far as, obviously screenings is going to be important for diabetes, but the folks that already know that they're diabetic, is the foot exam, are those things automatically brought into this into
Yeah.
their care and treatment, or
Yeah.
is this something you have to push on?
Yeah, there's challenges for sure. So, kind of again, we know that the American Diabetes Association, you mentioned the Amputation Prevention Alliance, which we work with, and really try to partner with organizations like that. The idea is we're advocating that there needs to be patient education, there needs to be provider education, and there needs to be payer education. We're all equally
Yeah.
responsible here, right? The patients, I think you bring up a really great point. I tell all of my patients, we know our primary care colleagues are very busy. They have so much to manage. Again, they have the diabetes and the blood pressure and the heart, and then somebody comes in with shoulder pain, right? They have to do all of that. But simple screenings
Yeah.
are really important, and asking a few key questions from the provider standpoint. And the other thing is, people ask me who's like the number one referral source to podiatrists. I always respond with, any provider who asks a patient to take their shoes and socks off can discover something, right? Because what we haven't necessarily talked about yet is the root of a lot of these problems is neuropathy. People with diabetes develop neuropathy. They lack feeling in their feet. They may step on something and not know it. So neuropathy is a problem, and the bottom of the feet, let's face it, are a challenge for anybody, thin, young, active, and healthy, to visually look at the bottom of your feet. But again, these people with diabetes, they have neuropathy, they don't have good feeling, they don't have good vision, they have mobility issues, so they can't see them. So I recommend that my patients, when they're sitting waiting for their primary care physician to come into the room, take your shoes and socks off, right? So that the primary care doc is for sure going to look at your feet. So I think there's a
Yeah.
component of patient advocacy for themselves and being aware of this. The providers need to follow ADA guidelines, which is an annual comprehensive foot exam. And again, I don't expect my primary care colleagues to do that comprehensive exam. That's why podiatrists are around. But those referrals and important early referrals for issues when there's a potential problem, certainly we encourage the primary care providers to do that. There's a natural symbiotic relationship between podiatry and vascular surgeons. We see a lot of the same patients who experience some complications. There's a kind of a catchy phrase in the field. We call it toe and flow. But that's the relationship between podiatrists and vascular surgeons, who typically at academic institutions like the University of Michigan, where I work, we try and collaborate on these high-risk patients. It does take a village. It does take the team. And then I would say the work that the Amputation Prevention Alliance is really doing in terms of advocacy for paying for preventative care. We're going to some value-based medicine, right? And I think
Yeah.
focusing on prevention and avoiding the costly complications, will hopefully point us in the right direction with that.
Absolutely. So you mentioned toe and flow. I mean, is there a one? Is there a correlation there that we should be aware of?
Many patients will have a component of circulation issues. And I train residents and students and fellows, and I like to have them think about my patients or their patients. Where are they on the spectrum of the disease process? If you're newly diagnosed, no complications, you're to the far left. If you've already had an amputation and you've already had a heart attack or a stroke, or you're on dialysis, you think about them, again, unfortunately, at the far right of the spectrum of the process. So I think it is an assumption, if you have diabetes, that is a risk factor for vascular disease. So we know that. Mental health, again, we've touched on that briefly, but we know probably mental health issues affect people with diabetes at 2 to 3 times the general population. And if you have a complication from your diabetes, like a toe amputation, those numbers for diabetes, distress, depression, anxiety, suicidal ideation, all of those things elevate. And it's natural. It's such a
Yeah.
burdensome disease to live with 24/7, right?
Oh,
So,
definitely. That's got to be a challenge. I mean, you always hear that most folks with diabetes are normally either high blood pressure and oftentimes overweight. I
right.
mean, is that normally what it is, or is that just what people say?
Yeah. No, there's truth to that. The statistics will show, I think, as I mentioned earlier, genetics plays a huge role, right? If diabetes is in your
Yeah.
family, then you are at risk to develop that. Weight definitely plays a significant role, and we know this from weight loss. So the classic marker for diabetes management and where are you in terms of control? Don't love that word, but are you doing well managing your diabetes? Is a blood test many people may know called a hemoglobin A1C. And the hemoglobin A1C tests your 3 month indicator of where your blood glucose levels have lived. And we know that weight loss, no medication, you do weight loss, your hemoglobin A1C will come down. There's a lot of media today about the new class of medications. People are taking these shots for weight loss. They're also indicated for diabetes. And everything that I'm reading is, if you're taking it for diabetes and the endocrinologist or the family doctor or the primary care doc has an option to treat a medicine that has an advantage of weight loss, that's really helpful for people with diabetes. So it's great that we have those advances too. But generally, vascular disease, as you mentioned, blood pressure issues, kidney disease, eye disease, neuropathy, these are all the host of potential problems. And we do know from lots of research and studies, the science will show the longer you live with diabetes, the more at risk you are. But it's also about how well your blood sugars are managed. So when my son was diagnosed, I'll never forget, his endocrinologist said, Evan, your generation can be the generation that will live with diabetes successfully. And he would say, you're going to hear diabetes is the leading cause of amputations and blindness and putting people on dialysis. But you know what? Well-managed diabetes is the leading cause of nothing. And I love when his endocrinologist said that to him, but it is about management of your blood sugars. And I'm not saying that's easy. It's again, very challenging, burdensome task, but well-managed diabetes doesn't lead to any complications. So that's what we're striving for.
Yeah, no, I mean, I completely agree. I mean, I think some of the things you pointed out, as far as, taking some ownership, access to communication, adoption of things that are available, whether
Yeah.
it's, remote patient monitoring devices and things
Yeah.
like that. So while we're on that, I guess let's talk about some of the best practices and approaches to addressing adherence challenges in the population we were talking about. Maybe we should touch on that.
Yeah. So I think a lot of these opportunities for remote patient monitoring, whether it be continuous glucose monitoring, that has been a game changer, right? For people living with diabetes, so they don't have to poke themselves. Your point
Yeah,
again, what we do at Podimetrics, it takes 20 seconds a day. And I heard you say, it's like, we need to get people in the habit of doing these things, right? So if something takes 20 seconds a day and it looks like a bath mat, we literally recommend that people put it in their bathroom and brush their teeth and take their scan at the same time. So we
Yeah.
want it to become an easy way that you can incorporate this habit into your daily life. Some people, it's okay, I'll do it every, I'll sit at the kitchen table, take my morning meds, and I'll do my scan. But when you can associate it and it becomes easy and something that you do every
Yeah.
day, then it's habit forming. And many of us make sure that that's how things tend to stick. Um,
Yeah.
I think access, as I mentioned, whether it's incorporation of technology, those are important aspects. And folks who we talked about, rural patients, underrepresented minority patients, my wish is that the providers who are managing these folks really look at remote patient monitoring and foot monitoring as an extension of their own practices in the patient's home, especially those that have challenges because they live far away from the clinic. It's like we've got eyes and ears on your patient between those usual visits. Nothing will ever replace the patient provider relationship. And the most
Right.
significant influence in healthcare, I believe, is the trust that we have with our provider. But I do believe strongly that the technology that we have um, can help to really augment that trust relationship. So when our mat senses that there's a potential problem and our nurses call the patient and they ascertain very important new actionable data and they relate that back to the provider, now we're seeing the right patient at the right time. We're prepared for a quality and efficient visit, which is something from the provider side we struggle with, right? We're all overbooked already in our clinics.
Yeah.
We only have 15 minutes with a patient. So we need to be seeing the right patients who need to be seen for that right reason. And when we can utilize technology and data to help us prepare for that efficient visit, it's quality. That's quality healthcare. So I encourage providers to adopt this technology early and utilize it in patients who could really benefit from it, which historically are the ones that haven't received it, right? So if you're struggling because you don't literally have money to put gas in the tank to drive 30 miles to your doctor, why wouldn't we want something in the home that can help us keep tabs on the patient, and make sure that they're not ending up in the emergency department, not ending up in a hospital bed, which is chaos, which is
Yeah.
costly. So I think doing more work in the home and utilizing, frankly, low cost interventions, they can be really, really influential.
I completely agree. I mean, it sounds like, I mean, those numbers were alarming that we cited earlier as far as amputations and things like that. It's just ridiculous. And I think, obviously we should all take action. I mean, what's your recommendation as far as advocating for awareness and communication? How can we get the message out there more? I think that's
Yeah.
important.
Yeah, I love the work that the Amputation Prevention, the American Diabetes Association. I think cross specialization, going to in the professional world and of providers, attending these types of lectures and conferences and working and acknowledging working as a team with the patient in the middle. That's really, really helpful. I think we see some of the barriers on the patient side is again today it's diabetes distress, it's mental health issues that are affecting our patients, it's health literacy, getting them to understand the potential cause and effect relationship. And I my gut is telling me that community-based programs are probably going to be most helpful for patients, especially in the underrepresented minority patient population. The church groups and the support groups and doing screenings on Sundays after church. Going into the community of San Antonio and kind of reframing how the classic mother of the family does all the cooking, right? And reframing to make sure that we're doing some interventions that make cultural sense to people and that they see the same lived experience. I mean, I feel like, again, I don't have the lived experience. Obviously, I think I'm passionate about this, but I've witnessed these healthcare inequities and healthcare disparities for the 25 years of my career, and it's
Yeah.
just it's upsetting. So I think acknowledging mental health distress, the overwhelming burden that diabetes is, and improving health literacy among all of us, getting patients, and that sets a different bar in terms of adherence. You mentioned that word earlier, making sure that people are engaged and doing the things that they can, meeting the patients where they are. But providers, I think we need to collaborate with each other, especially in these high-risk patient populations. We're pretty siloed, many of us, and we're cranking patients out in our individual offices or within our own healthcare systems, but coming together and understanding that there are healthcare provider shortages. So again, leverage technology to be the advantage. Everybody's excited about AI. Like, I don't need AI to help me diagnose or read an x-ray. That may be coming. What I need AI to do is help me predict potentially what patients I need to see based on their history. I need AI to
Yeah.
help me educate patients, put together some beautiful, patient education materials that are at their level. Do my
Yes.
charting for me. I want AI to do my charts so that I can be at my own kid's football game, right? On
Yes.
time. So I think there's a lot of work to be done, but a lot of it is probably in the social determinants of health and acknowledging that there are many non-clinical factors that influence clinical outcomes. I hope I'm answering your question.
Agreed.
Probably this is going
No,
on my.
great answer. I think, this the importance of this subject. Obviously, this is my third podcast on that diabetes related. So the first one was with the CEO Chuck Anderson from the American Diabetes Association,
Yeah,
and then
nice.
Dr. Masturzo from CCS Medical. So I think the importance is important is super important that we get the communication out there and address this challenge, and all as a community take this in heart, and help get this to a level that makes sense, because with what you're saying with the ages being younger, and just the severity of some of these things, it's not acceptable, and it's
We're
something we
not
can do
going in the
something
right.
about.
We're not going in the right direction. Yeah, I
Yeah.
agree. I agree. And we
So if
just
you
we just want people to
no, I
be
was going to
healthy
say, if you've
and
done
healthy
this for so
productive.
many
Yeah.
years and you have not seen an improvement, that's alarming.
Yeah,
It's pretty
yeah.
alarming.
It's concerning, which again is why I think this focus on prevention is where we need to be, right?
Yes.
Um, Instead of having a reactive sick care system, really focus
Yeah.
on prevention into a healthcare system. Is what
I,
I want
I,
for my
I
son, right? And I always again train residents and students, and I say you have to treat that person in the chair or in the hospital bed like they're your favorite person in the world, because they are
that's right.
someone's favorite person in the world, right? And you
Yeah.
wouldn't settle for an amputation if it could be avoided in your spouse, your mom, your dad, my kid, right? Like,
Yeah.
we need to do better for people that we love, for sure.
Absolutely. I mean, anything that we can, prevent that would have such a huge impact on our quality of life, we need to be more progressive and
Yeah.
proactive about. So thank you so much for taking the time today, and walking us through what's going on, and telling us a little bit about yourself and Podimetrics, and your journey as far as helping to curve this trajectory that we're on, that needs immediate attention. Any closing thoughts you want to leave us with? I know you're a very busy guy, and you're practicing
I
physician.
appreciate it. No, it's been wonderful to speak with you again. We're just really trying to make a difference, and that's been my quest, because I truly believe people living with diabetes, it's a complex problem. In much like cancer, all of our families at some point have probably been touched by cancer. the way we're going, probably many of our families in one way or another have been touched by diabetes as well. So, again, the mission is to have a healthcare system where people can just live healthy, productive lives and contribute in the ways that they all want to. So appreciate the opportunity to be with you and share a few thoughts, and appreciate your listeners out there too. And thanks for all the work that you do. Spreading the
Hey,
word.
thank you so much, Gary. I appreciate it. Thank you for joining us and educating us today. We'll talk soon and have a great weekend.
Thank you. You do the same.
Okay, take care. Thank you. Bye bye.